Hi, I'm Robin Krugman. I'm the owner and clinical director of BC in Therapy. I'm excited to have a conversation about what it's like getting started in therapy and how somatic therapy is different. I actually don't want you to prepare. A lot of people come in feeling, oh, I have to have my life story organized. I know exactly what to say. You don't. That's my job to figure out and to help you untangle everything. And that's one of the most common things that I hear from people is I don't even know where to start. And that is okay. We can start at the fight that you had with your spouse this morning. We can start with what prompted you to make the phone call. We can start with something that happened in childhood. It really is up to you. And I think that that's a really important part is you're in the driver's seat when you come in. I'm the guide. I know where to go, serve as your GPS. So my first question is actually, where do we want to start? Where do you want to start your story? And oftentimes people will say, I don't know, I'm not sure. And then if I just give a moment of silence to let them think, 99% of the time something comes up of where they want to start in therapy. So it's okay to be messy. It's okay to not be certain about what you want to talk about and just know that together we're going to develop a roadmap to helping you feel better and feel more like yourself. The unfavorable answer is both, because both pieces of information are helpful for us to get to know and understand. A lot of times we show up with current day stressors, and they're often linked and tied to things that have happened in the past, other relationships, other dynamics. So often, what I'll do is if someone comes in and says, I have these two things, I'm not sure, I might ask you, well, when you check in with your system, which one feels more distressing right now? If you were to pick, which one feels stronger? And the belief that I hold is you're actually the expert on yourself, your healing, and what your body needs to heal. And I am just your guide. Our bodies hold a lot of information. And oftentimes, especially as women, we overthink things. We go right to our thoughts, how to fix it. And I want to help you connect with what's actually happening in your body. Our body sensation and emotions can show up in so many different ways. For example, they could be subtle things, they could be fidgeting with your fingers, it could be a tightness in your chest, it could feel nauseous or a stomach ache. You could be sitting there with your fists clenched. So when I ask people to check in inside, check in what's happening in their body, I really almost taking a full body scan of where they're noticing some discomfort so we can get to know that a little bit better and understand what is it actually trying to tell you. The real work is the integration between our thinking minds and our body. The somatic work is really slowing down, right? So it sounds so counterintuitive to come to therapy to be in a little bit of distress, but to feel these things, to let yourself notice. Oh my gosh, every time I talk about this issue, I clench my fists. So usually if someone's clenching their fists like this, that shows me like there's some anger in there. It's so when people are holding on to things in their body, how we heal it is giving that space to have a voice. See, your fists are clenched right now. What do they want to do right now? Oh, they want to punch something. They want to hit something. Can we just imagine that? Can we give your body a chance to imagine that release? And oftentimes, when that release, there's something on the other side that comes through that feels healing and reparative and can help and shift and move things. I keep an eye on the clock because I want to make sure that as I'm helping you to open doors, I'm not going to ask questions and open a door as we're nearing the end of our session. But if something is heavier and opened up, I don't want people to leave feeling exposed and unzipped. So one of the things that is really important is called co-regulation. And so being able to help you get grounded, help you put your feet back on the floor, help you catch your breath and staying present in the room. The other important piece is as we get into the heavier stuff, people don't want to feel left alone with that. So, really letting you know how important this is and for us to come back to it at our next session when we have more time. But I think that that piece of trying to hold your emotions, trying to contain it, and using some grounding techniques so that you're not left feeling overwhelmed. I typically like to see people once a week. There are some circumstances where people's schedules or financial constraints, they can only come every other week. So if that's the case, then we work with that. It's important to be flexible. The sessions are 45 minutes to an hour. I like to leave that buffer because if in that situation that you were just talking about that something does come up, I want to make sure that we have time to appropriately close things up and help you leaving feeling grounded and not overwhelmed. How long are people typically in therapy? It really varies. The thing that I say to all of my clients, and it's a really strange thing to say, but my only goal for everyone coming in is I want you to fire me. And what I mean by that is I love that you want to come. I will be here. I will support you as long as you need me. And I want you to be at a place to say, I think I can do this on my own. And that is the best thing that can happen when I get fired in that way. When someone says, I'm good, I can do this. I do have a lot of clients who stay for a long time because once they start seeing, oh, I feel better. Oh, I don't have to hold this alone. Therapy is both hard and feels good at the same time. Again, strange things happen that like, people say to me, I don't want to be here. I don't want to come. And of course you don't. Coming to therapy is really hard and it can be scary and vulnerable. And then those same people who said, I didn't want to come, I don't want to be here right now, are the same people who say, oh my God, I'm so glad I came today. I feel so much better. So I think helping people to be able to get some relief session to session is really powerful and helpful to keep that momentum going, especially when you're coming to therapy to talk about hard things. What does worse look like? And why do you want to wait until you feel worse to book the appointment? I think there's a lot of reasons why people are on the fence. I don't have enough time. I can't because of my schedule. The thing I actually hear a lot is I'm not sure my symptoms are bad enough. You don't need to be bad enough or in distress enough or anything enough. If you are even considering, do I need therapy? If you're looking at it, you probably do. You probably could benefit from it. And so I think that the real question then just becomes, how much longer do you want to wait to get that relief? If you're watching this and something here resonates, you don't have to wait until things get worse. You don't have to be in crisis. If you're even considering therapy, that's really worth listening to. At BC in Therapy, we offer in-person sessions in Scotch Plains and virtual across New Jersey. The next step is simple. Schedule a consultation. We'll talk through what's going on with you. We'll answer any questions you have and make getting started with therapy as easy as possible. And more importantly, you get to decide whether this feels like it's the right fit or not. You don't have to do this alone, and you don't have to figure it out before reaching out.